Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about phase 2.5 detoxification. Someone posted a question about this on one of my previous videos, and it's a really great question. The question which I have up here is, what does phase 2.5 detox consist of / look like in a nutshell? In a nutshell, phase 2.5 detox is a term that's I don't think it's a widely known and used term. There are some clinicians that certainly do use it. I didn't make it up, but I think it's a really useful term because it describes the process. It describes the process that is required to take toxins that have been metabolized or processed in the liver cells, the hepatocytes, up to a certain point, and then they need to be transferred into the small intestine to be eliminated, through the feces eventually. So that transition from inside of a liver cell to in the like the center or the lumen, if you will, of the small intestine is what's generally referred to as phase 2.5 detox. So what that requires is the transport of those processed toxins in the bile through the biliary tree, as it's called. So these connecting tubes, if you will, that connect the various clusters of hepatocytes, so liver cells, to the small intestine. The gallbladder's involved there too if a person has a gallbladder still. Here in beautiful Nova Scotia where I practice, there was a rash of gallbladder removals in the past. So many patients without gallbladders. They're a little less gallbladder removal happy nowadays in our neck of the woods. But so if one has a gallbladder, then bile, of course, is stored in the gallbladder along with some of those toxins that are destined to be eliminated. But ultimately, the toxins need to move into the bile and then get into the small intestine. So the things that are required for that are a few. One is that bile, a large component of bile is something called phosphatidylcholine, which is this special fatty acid molecule. It's a phospholipid specifically, and the bile is one of the primary components of the phosphatidylcholine is a primary component of bile. Interestingly enough, we need to be able to methylate well. If you're not sure what methylation means, you can look up the methylation cycle. I've posted some videos about it before, if memory serves, and there's lots of resources out there. It's basically this series of biochemical reactions that occur in the various cells of our body. So we need to methylate well to make phosphatidylcholine. So if we have MTHFR gene defects or other genetic issues around our methylation cycle, or we're just really low in methylfolate intake or methyl B12 intake for some reason, that can impair our ability to make phosphatidylcholine. In our bile, we also require glycine, we also require taurine. We require several other components that are really important to in terms of making up the bile salts, as they're called, which are necessary to help transport different toxins in the bile into the small intestine. So, and then there's a lot of water in bile as well. So just staying hydrated, always an important thing to do. So so aside from the components of bile that are required, one of the other things that can be helpful in some cases is working with substances that are referred to as cholagogues. Cholagogues are basically substances that stimulate more bile production and bile release from the liver cells out into the biliary tree and the gallbladder and eventually into the small intestine. So certain cholagogues, and just as a friendly reminder, nothing I'm saying should be construed as medical advice, or you should always consult with your personal healthcare provider prior to making any health decisions for yourself. Please and thank you. But Colagog herbs would include things like greater celandine, also known as Chelidonia majus is the Latin name for that one, which is sometimes known as. Dandelion root can be a Colagog herb. Different herbs that contain berberine in them, like there's this Chinese herb called coptis, is also a cholagogue. And really any herb that has a bitter taste to it, so things like gentian would be considered cholagogues. Burdock root would be a cholagogue as well. So these are herbs that basically, again, stimulate more bile production and more bile excretion. So the thing with cholagogues we have to be a little bit careful with is that if the body's not ready for a big extra dumping of toxins, then it can sometimes cause some detoxification related symptoms like fatigue or joint pain, brain fog, headaches, bad breath, diarrhea, constipation, different things like that. And so we just have to be a bit mindful with Colagog. So when I prescribe them to my patients, I always recommend that they start with a lower dose and gradually increase them to make sure that they're tolerating it well. And typically we don't jump right into Colagogs. We want to make sure that there's adequate phase 1 and phase 2 liver detoxification pathway support happening first, because the last thing we want is for the hepatocytes to start dumping out toxins that have not been properly processed yet, because that could lead to potential problems with recirculating them in the body, maybe irritating the intestines, things like that. And sometimes we want to have binders in place like activated charcoal or chlorella or bentonite clay or things to that effect, so that any toxins that are excreted along with that extra dumping of bile are going to be bound up nice and efficiently in the intestinal tract. So I guess that wasn't really much of a nutshell. I mean, the video is over 5 minutes long, so hope it's a very large nut, the biggest nut you've ever seen. I hope that answers your question. Hopefully it answers it and then some. If there are any questions, any further questions about this topic or anything else, please feel free to post them in the comment section below, and I will do my best to answer them when I can.